Cervical sprain strain, or neck pain, can be quite detrimental when you're performing daily activities. So stick around to the end of the video for 2 tips on how to deal with this at home. Hi everyone, thank you so much for tuning in. My name is Dr. Vincenzo Romualdi. I am a chiropractor in Yorkville in downtown Toronto, and today we're going to be talking about cervical sprain strain and neck pain. Now, there is a lot of things that can cause neck pain, so before you look into this video for answers, make sure you consult your doctor or physician and make sure you're getting the best care and the most appropriate care for what you're going through. Now, in terms of the neck pain we're going to be talking about today, so we're going to be talking about a cervical sprain strain, which is referring to a muscle or ligament that has been strained or sprained in some manner. And we're going to be giving you some take-home tips at the end of the video today on how to deal with the pain at home. So your neck moves in many different directions and is one of the most important areas of your spine, as it's where your brain meets your body. Now, when you're dealing with neck pain, the most important thing to keep in mind, especially if it's a new pain, is to focus on pain-free range of motion. Now, what that means is if you're moving and that causes pain, don't do it. Come right off of the pain and stay there until your body heals enough that it doesn't cause pain in that direction. So today we're going to be going over 2 tips. The first tip is going to be dealing with those ranges of motion we just talked about. And the second tip is going to be dealing with the stretch. So the first tip is the range of motion, and essentially your neck moves in many different ranges of motion. We're going to go through them right now. So first it deals with flexion, extension, rotation side to side, and bending of the head or lateral flexion side to side. Now, if you have a new pain in the neck, you want to make sure that you're doing these very slowly, and again, if it's causing pain, coming just off of it and staying there for these stretches or these motions. So we're going to start with flexion, and you want to be flexing your neck until it hurts or until you can't go any further, and then remain there for about 10 seconds, and then coming back to neutral. We're going to extend now, remaining here for about 10 seconds. And remember not to do it if it causes pain. I don't want you fighting through the pain. Just hold it right before the pain. Okay, then we're going to be looking to our left, 10 seconds, right, 10 seconds, bending. And when you bend, I don't want you coupling it with rotation, just bending. So if this is where you're done bending, then that's where you're done bending. Don't try to force it, or don't try to use your shoulder to help bend some more. We're not trying to bring your ear to your shoulder. We're simply just bending the neck, and everyone's going to be different. Everyone is at different parts in their lives and different range of motion. So just bend it to where you can. Again, hold for 10 seconds and hold for 10 seconds. Now, this is a very good way to warm up your neck, especially if you have something going on already, and it will be a nice segue into the next stretch. So for this stretch, you're going to need one of 2 things, a towel or an exercise band. A towel works just perfectly fine. Now, if you're using a towel, you want to roll it up lengthwise so you have a lot of towel to deal with. And the purpose of this stretch is to aid in rotation as well as helping support the damaged structures. So what we're going to be doing is get your towel or exercise band and wrap it around the back of your neck. Now, you want to find the area that is most unstable or that is most painful. You can simply do that by palpating the neck, or while you're rotating, see where it hurts, and that's where you want to be putting the towel or the exercise band the most, because it will again help aid the motion as well as stabilize that joint. So when you wrap it around your neck, you're going to be pulling forward and resist just a bit. If it causes pain, obviously resist a little less. If we're looking to the left, we're going to be stabilizing with this hand here, and we're going to be pulling with this hand here. Now, it's a gentle pull. You should feel a nice stretch, and go to the range of motion until either you stop or it hurts. Now, see what I'm doing with my shoulders? I'm kind of pulling with my shoulders. Don't do that. What you want to be doing is straight, and try your best to keep your shoulders in neutral. And this will help aid your range of motion with rotation. Now, what you do to one side, you want to do the other side. So again, taking this, stabilizing here, pulling with this, and aiding in that rotation. And this should help alleviate some pain as well as getting the range of motion back into those muscles that are stopping you from going to where you want to go. So I hope this video helped. That is 2 tips on how to deal with cervical sprain, strain, or neck pain at home. Again, using a towel, rolled up towel, or an exercise band for the second tip, and then just going through basic ranges of motion in order to warm up your neck and making sure you're staying away from pain, pain-free range of motion, and that will get you back to where you need faster. Thank you so much, and have a great day.